Hello. Today we will discuss how to complete an asthma action plan using Centricity software. First, we begin by starting off with our test patient. You will open the document like any other office encounter. For this particular patient, it's a 69-year-old gentleman with a history of asthma. Here, we will upload the asthma management document. You can locate this document by going to the bottom of the screen on the left-hand corner and pressing Add. You will add form/text component. At this point, you can type in the word asthma. 4 different options will appear. For the asthma action plan, this portion is found in the asthma management section. The other options do provide vital information for history taking. We will start first with the asthma question Q&E HPI. We will select the document, then press OK. On this page, you will find different options which will help describe your patient's severity of asthma. First bullet contains symptoms. By clicking on the arrow to the right, it tells you the amount of times per week or daily or throughout the day if the patient is experiencing any symptoms. Next is nighttime awakenings. This again, if you go to the right where the arrow is located, gives you multiple options. Nighttime awakenings from 0 to 2 months, 2 times a month, 3 to 4 times a month, greater than 1 time a week but not nightly, or often 7 times a week. The next option discusses interference with normal daily activity. Again, going to the drop-down box, you'll have 4 options. The first is no limitations, next is minor limitations, followed by some limitations and extreme limitations. And finally, there is a tab or option for SABA use. This also has 4 options. First is 0 to 2 days a week. Next is greater than 2 days a week, but not greater than 1 times a day. Next is daily. And finally, several times per day. By clicking on these different options, it will help grade the severity of your patient's asthma, as well as how controlled they are under their current medication regimen. The options include intermittent, persistent, which is broken down into 3 categories: mild, moderate, and severe. Let's do an example. For example, say a patient has greater than 2 symptoms greater than 2 times a week, but not daily. This moves the patient into mild persistent asthma. Nighttime awakenings, 0 to 2 a month. Interferences with normal activity, say mild limitations. And how often do they use the short-acting bronchodilator? Say greater than 2 days a week, but not greater than 1 times a day. This then grades the severity of the asthma patient. So this patient would qualify for mild persistent asthma. You can even discuss how often patients require oral steroids for asthma exacerbations. Finally, on the bottom, there's recommended steps for initiating therapy. First step, short-acting beta agonist, PRN. Next step, preferred low-dose inhaled corticosteroid, followed by moderate persistent asthma, followed by severe persistent asthma, each with their own corresponding treatment options. Now that we know a little bit more about the different options for history taking for asthma, let's discuss asthma action plan. You'll again go to the bottom of the left-hand corner, go to add form in text. Again, type in asthma. This will take you to 4 options. Asthma management is the option that contains the asthma action plan. We will click on asthma management. Once added, you will have to press on the left-hand bottom corner and select the document for it to be added on the tab. This is the Asthma Management Dashboard. On this dashboard, you'll find 4 tabs which are located at the top: Assessment, Steps, Action Plan, and as well as options to stop different controller medications or prompts. We'll go back to the assessment portion. On the assessment portion, there's located asthma control level, whether or not patient is well controlled with their asthma, not well controlled, or poorly well controlled. On the assessment, it gives you the ability or option to use 3 different parameters for assessing a patient's asthma. This can be done by spirometry, peak flow, or AHEC. In this case, we will use a peak flow or peak expiratory flow to document or to complete our asthma action plan. Below is the recent peak flow. So if patient comes in for an asthma visit, you can have medical assistants perform peak flow prior to you seeing the patient, so that we can document what patient's peak flow currently is. The predicted peak expiratory flow for this patient, 69-year-old gentleman, the height of 73 inches, is 529. There's also an option for the patient's personal best peak flow. In this case, this patient's personal best peak expiratory flow is 300. Below shows history and reminders, whether or not the patient is on a controller medication, when they've had their assessment for their asthma, whether it's been well controlled or not, when the last time they've had an asthma action plan completed, if they've received their flu shot for this year, if they've received their pneumonia vaccine, and if they currently use tobacco. The prompts in green tell us that patient is currently up to date. The prompts in red tell us that patient is overdue. Below is the actions portion. These will list asthma medications. In the case of our patient, currently takes Advair, ProAir, and Montelukast. Below this, it has flu vaccine when it's been given, pneumonia vaccine when it's been given, and the current tobacco use if the patient is currently smoking tobacco. Next, we will go to the steps portion. For the steps portion, this is very similar to what was shown in the asthma Q&E HPI, the step up and step down approach. So which medications to start with, which medications to go to increase or to add to current regimen, or which medications to decrease or take away from current regimen. Finally, we will go to the asthma action plan. The asthma action plan can be labeled using patient's personal best peak expiratory flow or their predicted peak expiratory flow. For this patient, their personal best is 300 and the predicted is 529. You can also label what are potential triggers for patients with asthma: colds, exercise, animals, smoke, dust, food, weather, and air pollution. Any other additional triggers can also be documented using the free text component. Below, you can choose which peak expiratory flow you will use to measure patients' current asthma severity or control level. In this case, we will use patient's personal best peak expiratory flow. You can also use predicted peak expiratory flow. So we will start out with the green zone. The green zone is a zone in which the patient is doing well. So no cough, wheeze, chest tightness, or shortness of breath during the day or at night, and can complete usual activities. And if peak flow meter is used the peak flow is more than 240, or 80% of patient's best personal peak expiratory flow. Below this are medications you wish the patient to continue while in this zone. For this case, we have the patient continue the Advair and montelukast. This step is complete. We can now proceed going to the yellow zone. In the yellow zone, this is for patients with cough, wheeze, chest tightness or shortness of breath, having waking at night due to asthma, or have limited or decreased ability to perform usual activities, or peak expiratory flow of 150 to 240. We will then select medications that we would like the patient to use for this. And when they are in this zone, we will start with ProAir or albuterol. Patients instructed to take 2 puffs as needed for shortness of breath, and you can free text how often in the additional tab on the bottom. It also gives corresponding steps of what to do next. For example, next, if you are now better, continue with your green zone medications. For this patient, that consisted of the montelukast as well as the Advair. Or, if you haven't gotten much better, do the following. You can list additional medications you would like to prescribe. If patient's symptoms persist, you even have the ability to add option for oral steroids. If patient had previously been prescribed steroids and told not to use until an asthma exacerbation or until directed, you can also select this option. For example, patient can take prednisone 20 milligram tablet, 2 tablets once daily for asthma. And this can be selected from this option. We'll go to the next zone, which is the red zone. Red zone. This is for patients that are very short of breath or quick relief with medicines have not helped. Patient is unable to perform usual activities and symptoms are same or at worse after 24 hours in the yellow zone, or patient has a peak flow of less than 150 for this particular patient based off personal best predicted peak expiratory or personal best peak expiratory flow. From this option, you can continue to choose which medications patients should continue to take, whether or not you'd like them to continue taking ProAir, if you'd like them to continue taking prednisone, or if you would like to leave a message for the patient to get help now, call doctor, schedule an appointment, or go to the emergency department. All of this is already listed. Once this is completed, all you need to do is hit print and record action plan. It's important to note that the asthma action plan only gets counted as completed if this option is pressed. So at this time, we will print and record action plan. And that's it. We've completed an asthma action plan.